Welcome all of you here. Very pleased that many of you could join us today, and what a great way to end the week than to be here at the Institute of Politics. And I'd like to acknowledge Neil Levesque, who really has put the Institute of Politics on the map. Probably one of them right in the back here. He truly is a gem here at the college, and I've often said that one of the reasons they do so well here in recruitment of students is because of their interest in government and the Institute of Politics. So he has done an outstanding job, to say the least. I'd like to begin by also thanking our friends, BAE System, once again sponsoring today's program, and in particular our very, very good friend, Tom Bishop, who is representing the company today. As you know, that BAE has been a steadfast supporter and active member of the New England Council for many years, and we are grateful. But we also know how BAE is so involved in the community, and every worthy cause, you'll always see BAE very prominently mentioned, and we're blessed to have them. I'd like to just take a quick moment to tell you about some other upcoming New England Council events here in New England. We'll be right back at St. A's on June 25th, where we'll have our final Capitol Hill Report program with Congresswoman Annie Custer, who, as all of you know, will be retiring from the United States Congress at the end of the year. And we have several events in Washington, D.C., also in June, including a breakfast with Congressman Stephen Lynch of Boston, Congressman Jim McGovern of Worcester, as well as our D.C. kickoff of our Rise and Star Network for Young Professionals. I have been told that I am not a Rise and Star, but I am a booster of the Rise and Star, and Ashley Larkin, who is doing all our social media behind the camera. If you're interested in knowing more about the Rise and Stars and how you can participate, I'm sure she'll be more than happy to fill you in following our breakfast program today. Today we are truly honored to welcome back a great friend of the New England Council, a tremendous advocate for our region as well as our nation, and that's Senator Maggie Hassan. The senator now will be joining me on the stage for a fireside chat in a few moments, but to introduce and to give a formal introduction of the guest speaker, we've invited a representative of an incredible New Hampshire-based company to join us. Novacure is headquarters here in Portsmouth. It has developed a remarkable, innovative treatment that uses electric fields to kill cancer cells and shrink tumors. Needless to say, we're very proud to have them as a member of the New England Council, thankful for the company's important life-saving work. To introduce our guest today, I'm pleased to introduce Devin Oot, Manager of Community and Government Relations at Novacure. Okay.
That was a great introduction to Novacure, but for folks I don't know, my name is Devin Oot, and I work at Novacure, which is a global oncology company headquartered in Portsmouth, New Hampshire. Look for our new building coming in July. We're working to extend survival in some of the most aggressive forms of cancer using an innovative technology called Tumor Treating Fields. I would like to begin by thanking the New England Council for hosting us here today, and by giving a little bit of background about our special guest, U.S. Senator Maggie Hassan. Elected to represent the Granite State in the U.S. Senate in 2016, Senator Hassan previously served as our 81st governor of the state of New Hampshire and as the Senate Majority Leader in the state legislature. With nearly 2 decades worth of public service, Senator Hassan has long served as a tireless champion for New Hampshire families and patients. One area where the senator has been a tremendous ally for patients is her continued support in the fight to expand Medicare coverage for FDA-approved groundbreaking medical technologies, like the innovative cancer treating devices produced at Novacure. For those that might be unaware, there's often a lengthy period between FDA approval and Medicare coverage of new medical devices. In fact, the Centers for Medicare and Medicaid Services takes an additional 4.5 years before Medicare coverage typically happens. For these patients, who a majority are over 65, that is too long. In Novocure's case, despite FDA approval, it took us 8 additional years for Medicare coverage. If Novocure's therapy had been a drug and not a device, Medicare would have covered it almost instantly after FDA approval. That is why Senator Hassan, who has never been afraid to work with members of both parties to get things done for Granite Staters, joined with 9 of her Senate colleagues to issue bipartisan public letter that called on CMS to develop a rule that would ensure future Medicare coverage of new FDA-approved medical technologies that is flexible, predictable, and evidence-based. Thankfully, the agency now has the opportunity to heed Senator Hassan's calls and ensure that Medicare beneficiaries are afforded expedited access through the agency's proposed TSET pathway, which is incredible and a long-awaited time. I would like to close by stating on behalf of Novocure and all of our patients that we serve, we are beyond grateful for Senator Hassan's continued leadership on Capitol Hill. Once again, thank you so much for joining us here today, and I would like to now welcome to the stage U.S. Senator Maggie Hassan and the New England Council President and CEO, Jim Brett, for a fireside chat discussion, and Q&A will follow. Thank you.
Mic's on.
Mic is on.
Mic is on.
There we go.
So, Senator, what's new in the political arena?
Nothing much going on.
Nothing, no. Tell me,
Can
go
I
ahead.
start
Sure.
by just thanking Devin and Novocure for a really nice introduction, but more importantly, for those of you who don't know about Novocure, it's an incredible company, as so many companies represented here today and beyond are, and your advocacy and the advocacy of your patients has made a huge difference. So I just want to thank you again for the introduction, and it's a great example of that blend in New Hampshire, innovation and advocacy coming together and just making a real difference. So thank you.
So, what's going on in the political arena there, Senator? Do you want to talk about the last 24 hours?
Look, yeah, I know it's on everybody's mind. I have to say that I was not necessarily surprised by last night's verdict, but I was shocked by it because the thought that a former president of the United States would be convicted of felonies by a jury of his peers is a shocking thing. Never happened before in American history. But I also think it speaks to the strength of our legal system, the strength of our rule of law. The foundation for a democracy is that everybody is equal before the law and that everybody is included in our communities and in our civic life. And what we saw last night, was 12 ordinary Americans who had listened to evidence and processed it, listened to jury instructions, applied the law to the facts, and meeting the highest standard under the law beyond a reasonable doubt, decided, sadly and shockingly, that a former president of the United States had committed felonies. So I think it speaks to our rule of law, but it is a somber day, a somber time for the country.
Mm-hmm. You know, many people on one side feel as though the Justice Department has used their political weapon to destroy a candidate. Then you got others on the other side, some joyful with the decision. How in heaven's name do we get the country back together?
Look, what I get to see every day is the way people in New Hampshire work together. They show up at work, or they show up to volunteer at a food bank, or to be a Little League coach without asking everybody around them what political party they're in. And they solve problems all the time. because they share common sense, they share experience, they share expertise, they share care for their community. And so from my point of view, I get to witness that on a daily basis and remind myself that that's what my job is, to follow the example of my constituents and apply what I learn from them to the political process in Washington and sometimes the political process back here in the state. I will say just a couple of things, because I think it's important for people to remember what actually happened in the New York case. This was a district attorney in Manhattan's case. It was not the Biden Justice Department that prosecuted this case. The Biden Justice Department is prosecuting a case against Hunter Biden, which starts Monday morning. So I think it's really important, as we all think about what the rule of law means to us, to actually witness what is happening and pay attention to the facts on the ground, and put the partisan spin, whether it's on the left or the right, aside here. Because we do have a legal system that depends on the common sense and good judgment and adherence to an oath that jurors take. And members of both political parties who had different responses to this verdict last night all said this was an attentive jury that had been vetted by both sides. Some of them had expressed in the jury selection process that they aligned with former President Trump politically. Some of them had expressed that they don't. But what they did is they put that aside, they took an oath to, and we have a long history in the United States of juries doing that. And so I think we should be proud of that, and I think we need to continue to move forward. We now are in election season. We have to listen to candidates. We have to engage with our friends and neighbors and talk to them about what they're hearing and what they're seeing, what they care about, what challenges they're facing. And people have to be engaged in this election process and vote.
Devin, in her introduction, talked about you being bipartisan. You received that very special recognition in your career as being the most bipartisan United States Senator by the Lugar Center at the McCourt School in Georgetown. That's quite an accomplishment, to be the most bipartisan. And we need, obviously, people there to be bipartisan and work on legislation. But congratulations on that special recognition.
Well, thank you. I appreciate that. And I would, again, I won't repeat what I said earlier. The people in New Hampshire work together all the time. And that means that they really spur me to ask my colleagues on the other side of the aisle, hey, what are you hearing from your constituents? And not surprisingly, people in New Hampshire and people in Louisiana are talking about a lot of the same things. And they're not saying to themselves, this is a Republican issue or a Democratic issue. So the one other thing I'll say, though, and I think it's really important to realize the reason bipartisanship exists is because we're a democracy. Because when you're a democracy and you believe that every constituent of every senator or every congressperson matters equally, that means that we all have an equal seat at the table. And that means that compromise is required, because we have respect for the constituents that each of us represents, even if we have disagreements. You take away democracy, you take away the capacity of every citizen's vote to count equally, you begin to pull away or undermine the possibility for bipartisan solutions. I work in a bipartisan way because people in New Hampshire do. I work in a bipartisan way because I think it's creative, and I think it creates uniquely American solutions to things that are part of what makes us successful. But the day any elected official believes they are not accountable to the people and that election outcomes don't matter, the incentives for bipartisanship go away. And I think that's just really important for us all to remember as we're having this discussion about what kind of country we are.
Last fall you participated in an event that we hosted around the corner here on addiction and mental health behavior.
Yeah.
And we mentioned that it was so important to support the reauthorization of the Support Act. Can you tell us the status of that and how important it is to New Hampshire and really to the country?
Well, I just first of all want to thank you and the council for writing a letter to advocate for the reauthorization of the Support Act. The Support Act is what has gotten investments in New Hampshire and around the country for prevention, treatment, and recovery services, kind of building that addiction treatment infrastructure that is so critically important because the fentanyl epidemic continues to devastate our communities and our families. And so, and in fact, I will just tell you, I did an event on Wednesday with mental health, social work faculty, and Manchester school personnel because UNH is helping to train school social workers in the Manchester school system and increase the mental health resources in the Manchester school system at the same time. And I met a woman there who has lost 3 brothers to the opioid epidemic. And that is not a unique experience, sadly, in New Hampshire. So it's really important that we reauthorize the Support Act. It got through partly because of the council's advocacy. It got through the HELP committee. It was passed out of committee with a very strong bipartisan vote. And I am hopeful that as we do kind of end of the year finishing business, we will reauthorize the Support Act. It has huge bipartisan support. In the meantime, the administration has announced the opioid response grants that every state gets, and the good news is New Hampshire will actually get a little bit more than we've been getting. So we are going to be in a position to keep that infrastructure supported. We also passed something called the MAT Act. MAT stands for MAT, Medication Assisted Treatment. That is, according to all experts and all researchers now, the best way to treat especially fentanyl, but other opioid addictions. It's the prescription of a drug called buprenorphine, which cuts the cravings for opioids. It has proved to be really effective. Until the end of 2022, doctors had to get special permission to write a prescription for buprenorphine, even though they didn't need special permission to write a prescription for opioids. And so Lisa Murkowski and I teamed up. We got that special requirement lifted. And today, instead of there being 150,000 nationwide providers who could prescribe buprenorphine, there are now 1.8 million providers who are eligible to prescribe it. We still have work to do to train up physicians and other prescribers in how to effectively manage this kind of treatment, but it's a major step forward.
You know, staying on healthcare, Congress successfully authorized the extension of many of the Medicare telehealth flexibilities that were in place during the COVID-19 public health emergency. But that expires at the end of December of this year. Can you speak to the significance of telehealth to your constituents here in New Hampshire and your outlook on where this is going to go? Yeah,
so I think probably everybody in the room has now had some experience with telehealth, whether it's yourself or a family member. Telehealth has been supported by federal health programs for a while when it comes to patients in rural parts of the country. But obviously during the pandemic, we brought it up to a whole new level. And some of the telehealth provisions have been extended by the Department of Health and Human Services because they've had the power to do that. But we do have to reauthorize it. It has been not only really powerful for providing access for people in rural America, or people like in my family. Our son uses a wheelchair. He doesn't drive. It's very uncomfortable to take a 2-hour ride to a doctor for a quick checkup of a chronic condition. To be able to do that by telehealth is better for him, better for the healthcare system, more efficient. But in the areas of mental health and addiction treatment, it has proved to be really, really important and effective, which we weren't sure it would be at the beginning of the pandemic. We thought, well, maybe people won't want to do counseling in their home. Person to person is better. There were concerns that people on, for instance, methadone being treated for addiction that way might abuse telehealth, not having to go to a methadone clinic, what we discovered is we actually increased access for this critical population. Mental health patients, addiction patients were more likely to keep their appointments, seemed more comfortable having appointments that they could have from the comfort of their home. They didn't have to go into a waiting room, be with other people, fill out the clipboard. And so it isn't that in-person interaction isn't important, and we're going to have to get this balance right, but it is a really important tool for treating mental health and substance use disorder, not only because patients take it up more, but because it will provide access. You know, we're going to have to deal with some licensing requirements too. When we have a healthcare shortage, to be able to get access to a provider in a different state through telehealth is another way of being a force multiplier here.
Earlier this month, the New England Council brought some 250 New Englanders down to Washington to meet with many senators and congressmen and people from the White House, but we had an opportunity to meet with your staff to talk about health care shortages in New Hampshire. Can you talk a little bit about what you're hearing from your constituents here and the role that maybe you and your colleagues can do to try to help alleviate the problem?
Kind of everywhere I go, there are several issues that keep coming up. Workforce shortages generally keep coming up. Look at the unemployment rate, it's at a historic low. But in healthcare, it's a particular issue, and if any of you have spent time in the hospital yourself or with a loved one, you've seen it firsthand. I certainly have. So we are hearing about it. A lot of New Hampshire healthcare providers are incredibly creative, and they've been creating career pathways and weekend training programs to get staff into a career in healthcare and then helping them upskill on a gradual basis. And that's been incredibly resourceful and important, but we have more work to do. And so the congressional perspective here is that we can make it more affordable for people to pursue healthcare professions, so more loan forgiveness, more student aid, so people can go into healthcare without the prospect of this huge amount of student debt, making loan repayment depend a little bit on where you decide to practice. So if you want to go to a rural area, we might provide additional loan repayment there. We've had a lot of hearings on the challenges of getting healthcare workers into rural America. And we're also just looking at ways to kind of increase the number of residencies, increase the number of nursing school slots. We have to increase faculty as well as additional clinical slots for people so we can get more people in the pipeline faster. Lastly, we're seeing some innovations here in New Hampshire where people are able to do their clinical training more quickly in different settings, which would make a big difference in getting people into the workforce faster.
Earlier this year, the New England Council sent a letter supporting continuing the funding for the Affordable Connectivity Program that I believe was launched in December of 21. It's already helped some 23 million households gain access to affordable broadband. I believe some 39,000 here in New Hampshire and 800,000 in New England. So obviously it's a very important piece of legislation that you supported, and many people are appreciative of it. Your colleague from Vermont, fellow New Englander, Peter Welch, has authored a piece of legislation to extend the act. Can you talk about the status of it and whether it's going to pass this session?
So the Affordable Connectivity Program, and thank you and the Council for your advocacy for it, was part of what we put together in the rescue plan, which recognized that there were two basic barriers to high-speed internet access for Americans, for Granite Staters. One was a lot of people live in areas where there wasn't the physical infrastructure for high-speed internet. That's very true in New Hampshire. So between the rescue plan and the infrastructure bill, we have provided critical funding to get high-speed internet to every corner of New Hampshire, and it's been really exciting to travel around the state and talk to people who are finally able to use better than dial-up I was up in Sugar Hill and just talking to everybody from the librarian to business people to one family where they had to balance the dad's work needs, the mom's work needs, and the 3 students during the pandemic on like a DSL line. And it was, everybody had to take their turn at the computer. So that's a really exciting development. But the second barrier is affordability. Even if you can physically hook up to high-speed internet, it may just cost too much given your family's economic situation. So the ACP is the piece that says we will help subsidize the monthly cost of high-speed internet for certain families that qualify. It was very popular. It made a huge difference. Think about the things we've talked about, telehealth. You can't do telehealth if you don't have high-speed internet. You can't, although I will say there are provisions for telephone calls which sometimes are appropriate, so just for older Americans in particular, this may be a good way they can check in with their doctors. But mostly, you can't do telehealth. You can't do modern education. You can't do a whole lot of other things for work and home without access to high-speed internet. It was so popular that the program ran out of money, so we need to refund it. Senator Welch is phenomenal because he raises this at every single meeting the senator we have, Democrats, Republicans, all of us, and I am hopeful that it will work its way into an end-of-the-year package. But advocacy is really important here because it's not just about, if you think about it, it's important for the families who otherwise can't afford it, but for all of you who do business and need customers, or for all of you who provide services over the internet, you want your patients, your customers, your students, your citizens to be able to communicate with you over high-speed internet. So it's in everyone's interest to find a way to get this done.
As we move through the latter half of this Congress, there are many questions of what will be done. And one issue that our members of the New England Council care about is the R&D, amortization tax issue, which has been rolled into the bipartisan tax deal that passed the House and now waiting for action in the United States Senate. So what do you see the prospects of this bill passing this Congress?
Yeah, this is one of the things I have been working on for a long time here. As you know, in 2017, when the new tax law passed, the rules for research and development tax deductions changed, and that change became effective this last year. And I am a strong supporter of the research and development tax credit, and I think it should be able to be deducted in the first year in its full amount. And it has made a critical difference for New Hampshire businesses, for American business, and we need to restore it. My partner in this effort is Todd Young, Republican from Indiana. As you noted, this was put together in a bipartisan package in the House. Jason Smith, Republican chair of Ways and Means, paired it with a tailored child tax credit that would direct an increased child tax credit to the poorest families with the most kids, which there's bipartisan agreement is the people we think need the child tax credit the most. And it passed the House of Representatives by a suspension rule, which means there was huge support for it, so they were willing to take a 2/3 vote to go around the rules to get it done. And it got to the Senate. It also has critical funding for low-income housing, for the low-income housing tax credit, an increase there because we know how much more housing we need in the country. And then in the Senate, even though a lot of bipartisan support, leadership on the other side of the aisle said they didn't want to do it right now. There is speculation as to why, and some of it people think they'd rather wait till next year when they think they might have won the election and therefore be able to tailor it the way they want to. There's speculation that the other team doesn't want to give President Biden a success here. I don't know. But I will tell you that we keep pushing. And I basically have said to some of my Republican colleagues, if the House of Representatives could do it in a bipartisan way, can't the Senate do it in a bipartisan way? So we'll try.
I mean, you mentioned some of your priorities on the 2017 tax cuts that were proposed and enacted by President Trump that will expire next year. the ones, your priorities in keeping them would be what? The low-income housing tax credit?
Look, it is still kind of too early to tell how this is all going to shape up, but the current bipartisan bill we have, restoring full deductibility for the R&D tax credit, and there are a couple of other critical business tax pieces here that help, in particular, small businesses that are really important. A targeted child tax credit, that's a tax cut for working families. That's the difference between being able to sign your kid up for Little League and afford the uniform or not, right? It's being able to pay down your credit card debt. It's being able to afford a new car or a new used car so you can get a job and get to work. So those are really important priorities. So is housing. And I don't have to tell this audience about our housing shortage. I hear about it from all of you every day, and you are right to be raising it every day. We are making some progress in New Hampshire. Just was at an opening of low-income housing in Rochester that Easter Seals spearheaded, which was just great. But we have a lot of work to do, and increasing most affordable housing in this country is built by use of the low-income housing tax credits. Increasing that, which is what this bill provides for, would be really important.
Is it safe to say that the child tax credit is one issue that's holding up voting on the combined tax bill?
I don't think so, actually, because, first of all, Jason Smith is a very conservative Republican chair of Ways and Means in the House. He supports this provision. A lot of conservatives do. It's a very targeted thing. There was one objection raised to one of its provisions by Republicans in the Senate, and we actually offered to take it out. And once we did, they said, well, we still don't want to pass it. So I think that there's some bigger dynamics going on, but I think that's why we're going to continue to advocate and continue to push. And I'm hoping to get the bill, to the floor for a vote. But as you know, floor time on the United States Senate, because the way the Senate works, is a limited thing.
Extending all expiring individual and estate tax cuts, along with the business tax changes that Republicans favor, would reduce projected revenue by $4 trillion over the next decade, according to the Congressional Joint Committee on Taxation. So that would be on top of the $20 trillion and now deficit projected over the current laws. This deficit keeps growing and growing and growing. It's over $35 trillion right now. It's about 10% of the GDP. We're paying almost $700 million every year on the interest alone that could go to so many other programs in healthcare and education, what have you. Will there ever be the will to work together to address the deficit?
There should be. We have a history in this country, as recently as the Clinton administration, of getting back to balanced numbers here. And this is about making sure that we have a tax system that is fair to families and fair to businesses, and where the wealthiest Americans and the wealthiest corporations pay their fair share. It is also about coming together to save money in the federal government. I'm chair of a subcommittee called Emerging Threats and Spending Oversight, kind of two separate things, but it's a subcommittee in the Homeland Security Committee. And on the spending oversight piece, there are a lot of things that we can do that saves hundreds of millions of dollars, billions of dollars. We get a report from the GAO every year of duplicative programs in the federal government. If we would follow that report's recommendations, billions of dollars saved. If we changed the way we made our metal currency, that's a $10 million savings, like off the bat. We've taken steps to negotiate prescription drug costs. That's hundreds of billions of dollars of savings to the Medicare program, right? If we had the power to negotiate with more prescription drug companies, we can bring those costs down more. So there's a lot we can do, but that does take political will, and it takes some level of creativity here because, programs get started kind of a silo at a time, and they all have their stakeholders and constituencies. And sometimes the stakeholders and constituencies will come to you and say, this is why you shouldn't merge it with other things, and they have a point. But there are times when we just aren't willing to change, even though decades have passed. So there's a lot we can do to save money. There's more we need to do to make sure that our tax system is fair, that the wealthiest are paying their fair share. But we also need to make sure ultimately that this is a predictable, fair, and certain tax systems so that businesses and families can plan. And that's why, getting the R&D deductibility back, doing some other things is so important. But that's the way I try to approach this. But do know that there is low-hanging fruit in the federal government where we could save significant dollars. And that's one of the things I've been focused on. Senator Romney and I team up on this a lot.
Speaking of change, do you think that there should be any change in the filibuster?
After a lot of reflection, I think we should have some change in the filibuster. So you all know the filibuster is the rule in the United States Senate that says in order to close debate on any particular bill, we have to have 60 votes. And the kind of historic way it worked was if you really didn't want a bill to pass, you could get up and keep talking on the United States Senate and just blocking the final vote to close debate. That has morphed now into a system whereby unless people who want the bill to pass can produce 60 votes at the beginning of the process, we can't take a vote on final action on a bill. And what it has done is instead of, it was established to protect the minority voice, which is an important part of our constitutional system. It's what James Madison focused a lot of his attention about. It has morphed from protection of minority voices, making sure that the people who object the most to something have time to make their argument, time to persuade their colleagues that we're wrong. It's morphed into a veto power given to the minority. So I think it's still a very important thing to have some breaks in the Senate to incentivize bipartisanship, but there are ways we could change the filibuster system to put the onus on the people who are trying to block what the majority already supports, including the majority of the American people. I mean, so Senator Merkley has a number of proposals that really would say, for instance, if you want to block a vote on a bill for which there is majority support, you have to show up with 40 votes to block it, as opposed to the majority having to show up with 60 votes to pass it. Just shifting that burden a little bit, it would still protect the minority, it would still incentivize us to come together and find bipartisan solutions to things, but it would make it less automatic. Right now, when one senator says, I'm not going to consent to accelerating the timeline on something that's really important, or a few senators say, no, I just object, I'm not going to tell you why, but they can literally just send an email saying, no, I'm not going to do it, it grinds things to a halt. And I think we need more transparency, and I think people should have to come to the Senate floor and state their case against it if they really want to block something.
Do you think there will be some changes made this year?
Look, as you all probably know, the last time this came up on the Senate floor was when the voting rights bill was before us, and we weren't able to change the rules. And this was, again, a modest adjustment to the rules. It wasn't an elimination of the filibuster. So right now we don't have the votes for it. The election results will dictate kind of who has the majority in the Senate, and then what that majority looks like and what the individual senators think about doing that.
You know, the President Biden will be adding an increase in tariffs on certain products imported from China, in particular steel, some 25% increase. and a tariff of 100%
Yeah.
on Chinese electric vehicles. Your thoughts, and this is a productive way of addressing the...
Look, I was part of a bipartisan delegation to China in the fall with Senator Schumer. We met with officials, including President Xi. What we had been hearing from our constituent businesses was real concerns about the unlevel playing field that China is competing on, particularly how it treats businesses, including automobile businesses in China who are American. And so I think it is important. We have taken steps, obviously, to limit the transfer of technology to China when it comes to technology like semiconductor technology that's incredibly important to our national security. We have also been saying to China, if you want to compete on an even playing field, we're happy to do that, but you really can't use the Chinese Communist Party and the Chinese government to tilt the playing field as significantly as you are, which they continue to do. So I think this is an important first step. I think we're going to have to see kind of how this impacts the market. But the other thing is, we have emerging EV manufacturing here that we're really good at. We obviously passed the Chips and Science Act, so we're producing our own semiconductors here. We need to protect these nascent efforts in the United States, not only for our economic benefit, but also for our self-sufficiency and our security.
Mm-hmm. The Senate just reintroduced the immigration bill once again,
Yeah.
and unfortunately it was unsuccessful.
Right.
But really bipartisan.
Yeah.
Members voted against the bill.
Yeah.
This is a big issue for the Democrats. Seems to be Achilles' heel, and the campaign trail is the Democrats don't have a solution on immigration. There's a perception,
Yeah.
open borders, and you tried to address it with that very, I thought it was a very comprehensive bill. It was tough in many ways,
Yeah.
but needed, and again, bipartisan with Senator Chris Murphy in Connecticut and Senator James Lankford, who, as an observer, I can't think of a more conservative Republican in the United States Senate than Senator Lankford of Oklahoma, and yet the bill was rejected. Going forward, this is just off the table now, immigration, until the campaign is over.
Let me just take a step back. This is a really important issue for the country. We need secure borders. End of discussion. And I've been sitting on the Homeland Security Committee since I got to the Senate. It was an issue that concerned me as governor too. The first job of government is to keep people safe, and so there have been a number of efforts by Democrats and Republicans to get increased funding to the border, to listen to our frontline border security people and say, what do you need? And they'll tell you they need more people. They need more technology, and our asylum adjudication system needs more people so that when unauthorized migrants show up at the border and claim asylum, which they have a legal right to do, that's part of our law, instead of waiting 8 years for an asylum ruling, we could get them through the process in a month or two, and if they don't qualify for asylum, we would deport them. If that were happening, then the social media communication that we see all globally that says if you can get across the border and claim asylum, you can stay for 8 years until they rule on it. If we were ruling on these in a couple of months' time, the incentives to try to cross the border would go way, way down. We also need more technology, not only for detecting people trying to cross the border in between ports of entry, but for detecting fentanyl. So there's a whole lot of things that we know we need to do, and a lot of us, in a bipartisan way, have been pushing for this for years. And in some cases, in the infrastructure deal, in some other bills we put together, we have increased funding for the border. I've also focused on the fact what Border Patrol kept telling me, and what officials in Mexico will keep telling you, is Americans sent a ton of guns and cash over the border into Mexico illegally. That funds the cartels. that are poisoning our families with fentanyl. So we have work to do there too. That's all by way of kind of setting the stage. There is bipartisan support for making significant, massive changes at the border that would make it more secure. We also need to refresh our immigration policy. We've all talked about workforce shortages, and there are select and appropriate ways that we could manage our visas for workers that we have done throughout our history, making sure we're protecting American jobs, but also making sure we're addressing shortages that Americans aren't filling, right? These were all parts of this bipartisan deal. And I just want to take a step back and say to folks, this is what happened, right? The president, when he proposed the supplemental security bill to get aid to Ukraine, to get aid to Israel, to get humanitarian aid, also said we need more funding at the border. So the Republicans said we don't like the president's border proposal, so we put together this bipartisan team. It was actually a tripartisan team. Kyrsten Sinema, independent from Arizona, lives in a border state, knows the issue incredibly well. Chris Murphy, appropriator who deals with border issues, knows the issues incredibly well. My friend and colleague James Lankford from Oklahoma, one of the most conservative members of the Senate, one of the smartest members of the Senate. He joined his high school debate club in 4th grade. So you can imagine what debating with him can be like. He's wonderful. And they worked for 4 months to come up with a bipartisan deal. It had Republican priorities, it had Democratic priorities, it had an independent streak about kind of practical problem solving too from Senator Sinema, who knows the issue so well and so familiarly. And we got to a place where those three agreed on text, and they kept going back to their colleagues in both caucuses saying, is this okay with you guys? Is this okay with you guys? There was agreement in the United States Senate that we should pass this. The text got published, and Donald Trump said, do not pass this because I want the issue for the campaign. I will tell you all, I've been named the most bipartisan senator in the United States Senate. I love my colleagues on both sides of the aisle. In 2013, there was a bipartisan agreement on immigration reform, and it was killed by the Republican Party. In 2018, 2019, after that big government shutdown, 35 of us agreed to comprehensive border security reform. Both parties sitting in Susan Collins' office for weeks. We got 35 people to sign on to a bipartisan deal. And that night when we sent it over to the White House, to Donald Trump's White House, he said, kill it, because I like the issue as a campaign issue. And that's what he has done again. So I'm sorry for this moment being a bit partisan here, or maybe being a bit partisan when it comes to the former president. But that's what happened. And so we gave our colleagues another opportunity to vote on this bipartisan deal that one of the most conservative law enforcement unions in the country endorsed, the association that represents our CBP personnel on the border, endorsed this bill. They said it would work, it will make the border more secure, we need it. And my colleagues on the other side of the aisle walked away from it because the former president told them to. In this latest vote, a few of my colleagues on the Democratic side walked away from it too because they didn't like some of the proposals. It's a compromise. And compromise essentially means you agree to do things you don't want to do. But because your colleagues and their constituents think it is a good idea, you're Americans and you say, okay, so you get some of what you want and we get some of what we want. That's the way we operate or have historically in this country to make long-lasting, sustainable change. And so to say that I am disappointed by this is an understatement because the issues at the border are real. The good news is the president continues to take executive action to try to make the border safer. We have funded more agents, we have funded more technology, but we had a real opportunity here to do something that would make it considerably more safer. And while we have made some changes that will help us combat the fentanyl epidemic, this had additional provisions that are really important for that. So I'm going to keep pushing for this. The text is there. The work that went into it from my 3 colleagues is extraordinary work, and we're going to keep trying to get it passed.
The current farm bill will expire on September 30th. Will there be an extension? Do you think there'll be a bipartisan support on it? Apparently there are some people, at least in the House, have some serious concerns about the SNAP nutrition program, that it should be either neutral, which means there might be a substantial cut in the food stamps and what have you. So your thoughts on whether we're going to see this bill pass?
This is one of the areas where I really don't know, because some of the changes that the House made to the Farm Bill are really, really concerning. The funding for the SNAP program for food stamps for kids is really important. I'll say, I spent Wednesday talking with Manchester school personnel and UNH social work faculty about this new program that they've put together to get mental health counselors into the Manchester schools at a level that our kids need. When you talk with educators about why our kids are struggling, I think it's Fox News did a survey of teachers nationwide. Something like 70% say they have been faced with violence in the schools in the United States of America. Part of the reason is that when kids come to school hungry on Monday morning, they have behavior issues. Feeding children should be the easiest thing for this country to do. We are the wealthiest country in the world. We have a huge agriculture sector. Feeding our children should be the easiest, most fundamental thing that we do. And so the steps that the House took to cut back on food stamps for kids is really problematic. And so I don't, we're going to keep pushing. I know Chairman Stabenow in the Senate is really working hard to try to get the conversation going with our colleagues on the other side of the aisle. We need to pass a farm bill, but we also need to feed our children.
I know we're coming to an end, and I see your staff walking up and down the...
They're doing their thing.
They're doing their thing. If I could just one last question. You have a lot of higher ed people here, and do you think time is running out to fix America's student aid mess that we have? The free... Yeah, the FAFSA
what is it
called?
form.
Free application from federal student aid.
Yeah. What has happened there is unacceptable. So just to back up, Congress passed a law that said we should make the student aid, financial aid form more streamlined, easier, better. What's in the law is streamlined, easier, better. Mm-hmm. The implementation has been terrible. The person in charge of it has now resigned and left the administration. The Department of Education has taken steps to improve and get this back on track. And the department has ordered a top-to-bottom review so that these problems will not, we hope, impact the next application cycle. What I would say to everybody here is if you know a family where someone's applying to college and financial aid is a big issue and the FAFSA form problem has delayed the delivery of a financial aid package to them, or they haven't been able to complete their application yet, they should continue to work with the colleges and universities that they're interested in attending. The colleges and universities want to be flexible here, and the Department of Education is giving them space to be flexible. So keep at it, because they are fixing a lot of the issues, and a lot of deadlines that normally apply have been extended, understanding that this is a problem. But at the end of the day, the top-to-bottom review has to come up with recommendations that will mean that this will never happen to our families and our young people and prospective students and our universities and colleges again.
think I read somewhere that there was a 13% drop between this time last year and the number of applications for the student loan.
Yeah.
Are you concerned that we might be losing some students going into colleges this year?
That is definitely a concern that I have heard from our colleges and universities and from some families, and that's why I raised this with the president. I raised it with the Secretary of Education. I've raised it with the president's chief of staff. We keep saying, we have to be clear with people that flexibilities continue, and that if somebody finally gets their financial aid package in July, that they're still going to have some options here. And that's what we're trying to do, is just say to people, keep at it, keep working, keep in communication with the schools or colleges you're interested in. They want you to matriculate. Again, what happened here, the implementation is unacceptable, but here we are, and we are now just trying, to get through all the issues, get people to school if that's what they still want to do, get them their financial aid, and then just make sure this doesn't happen again.
Well, I have more questions, but time has run out. I hope you found it informative and enlightening, but obviously the Senator has great grasp of the issues, and she has an awful lot on her plate. But most importantly, she's so accessible to all of us, which is one of her trademarks that has stood well with her and her reputation, being very approachable. She's looking for input on some of these perplexing problems that we face. But I just want to thank all of you for coming. I hope you enjoyed it. But again, congratulations to the Senator. As I began, she should be congratulated as being the most bipartisan senator. So when you think of all the chaos, and there's a lot in the United States Congress and Senate, just think of your own senator here being number one bipartisan, saying, I am there to work across the aisle to get meaningful legislation passed that will improve the lives, not only her residents, constituents, but our country. So well done, Senator. Continued success.
Thank you very much.
All right.
Thank you all very much.